Hello and welcome everybody. It's great to see you all at this, the latest of our series of lunchtime staff Q&A sessions about vaccinations. This is the third one that I've been involved with, but I know there's been many more before that. We're really delighted. We've got about 130 people booked onto this one, which is going to focus on flu vaccinations and COVID booster vaccinations. Having said that, we don't need to restrict our questions to that. If you've got other vaccination related questions, they're a bit broader than that, we're quite happy to receive them and do our best to answer them. If there's something that really stumps us and we can't answer it on the day, we will take a note of that and we'll issue an answer to the question after the event. So keep the questions coming. The format this time is a little bit different to what we've done before. So those of you that have attended before, we've just gone straight into questions and answers. On this occasion, we've got Professor Kevin Fenton here to speak to us, and he's going to do a little presentation about why it's so important to protect yourself this winter by having the flu and the booster vaccination. He's really ideally placed to discuss this topic with you, because he is the Regional Director for London in the Office of Health Improvement and Disparities. He's also the Regional Director for Public Health in London, and he advises the Mayor of London as well on health issues. So it's got a very broad range of expert knowledge, so I'm sure the presentation will be really interesting. Probably answer some of the questions that you've thought of already just during that presentation. Following that, Kevin can stay for another 15 minutes or so, so we'll direct a few of your specific questions to him initially. When he goes, we've then got our usual panel of experts that includes two GPs who you'll have heard from before if you've attended before. That's Ogi Aluzu and Tessin Khan. They're both practicing GPs, but they've got a special interest and role in the vaccine programme. We've got a HR specialist, Elaine Turner. I think it's her first appearance on this panel. And we've got a flu vaccination programme manager who's an immunisation commissioning manager in her day job, and that's Khalida Aziz. So I'm going to get out of your way as quickly as possible so that I can hand over to Kevin. Just to say, we will be recording this session, but without any further ado, I'm just going to send Kevin live and look forward to hearing from him.
Lovely, thank you. Thank you, Dan, and good afternoon, everyone. There's a little bit of feedback on the line, so I'm not sure if colleagues are on mute. Thank you. So good afternoon, everyone. I hope you can hear me clearly. I'm Kevin Fenton, and it's a real pleasure to be with you here this afternoon. This is such an important time because we are now really dealing with and in the midst of both the winter period as well as the emergence of a new variant. So now more than ever before, getting vaccinated, getting your booster, encouraging others who you're in contact with to be safe during this winter period is going to be absolutely critical. In the presentation, I'm going to quickly reflect on where we are with the pandemic, where we are with vaccines, why they're important, and I'll end with a reflection on the booster program and the flu vaccine program. And then I'll be happy to answer any questions that you may have. So as I said, this is an important time because rates of infection are again increasing across the country, and certainly in London, we're beginning to see an uptick in infections at the moment. Although these are largely in younger people who've been unvaccinated, we're also seeing increases in other age groups as well. And COVID has had a devastating impact on us here in the UK, with more than 140,000 people having lost their lives throughout the course of the pandemic. And we know that every day more than 100 individuals across the UK die from this disease. So the pandemic is not over, and all of our efforts to prevent, to treat, and to manage the infection are key, and vaccines are a key part of this. And the UK has done an exemplary job in getting the vaccines out in terms of ensuring that we are able to get the first doses and the second doses out. And we're increasing the number of people who've had a third dose or booster, because we now understand that to be fully vaccinated does require 3 doses. The 2 primary ones that we've had, and now the booster shot. So we'll reflect a little bit on that. 2 years into the pandemic, we now have a better sense of what we all need to do to prevent and to manage COVID. And this chart just shows all the lessons that we've learned over the last 22 months as we've been navigating and managing the pandemic. So from hand washing to wearing face masks to cleaning the environment and ventilation, straight through to testing, screening, social distancing, using PPE. We have so many things now in the toolkit that really help us to prevent the infection. But the most powerful of these is, in fact, the vaccine. And the vaccine is important because, as with other infectious diseases, when you have a vaccine, it is really a very strong way of boosting your immune system to both prevent severe disease and death from the infection. So the vaccines are really effective, not only in reducing your risk of becoming infected, but even more so preventing you becoming severely ill and requiring intensive care admission and from dying from the disease. So these are 6 reasons why we are so keen for everyone to benefit from the vaccines. We know there are millions of people across the UK and billions globally who've received the vaccine. So for those of us who are waiting to see the safety profile and to have more people have it before we did, we now have billions of people globally who've had the vaccine. We know it's working to keep people out of hospital. We know it's working to prevent death. We know it is working in helping us to recognize and fight the infection. It has been infected with the Delta variant. We will learn how effective it is for the new Omicron variant. We know it's highly effective for preventing women who are pregnant from getting severe disease and in protecting their babies. And now the guidelines are absolutely clear. If you are pregnant, get the vaccine, because if you become infected with COVID and don't have the vaccine, you will have a worse outcome. So we now know, after billions of people have received this, that actually when you're pregnant, getting the vaccine is a good thing. And this is having a huge impact on changing the course of the pandemic. And this was going to be a key part of ending the pandemic. The more people either acquire infection and develop natural immunity and supplement that with a vaccine dose, or those who haven't had the infection but are able to complete the 3 doses, which we now recognize as being important to maximizing your immune response. So I had a little vaccine. I had a little video here on how the vaccines work. It is just a minute long, but it really is a good way of reflecting on and understanding how the vaccines work. So I'll play this now, and hopefully you'll be able to see this. I'm sorry, can I just check? Can you see the video or not? Okay. I will try again. Great. So I just wanted to share that because it will form the basis of the questions that we have a little bit later on in terms of how the vaccines work and the information that you need to be confident about the safety of the vaccines. Now, what I wanted to do next was really just to reflect a little bit on that will teach me about using multiple medias. I wanted to reflect a little bit on the safety of the vaccine and the boosters, the side effects, as well as the importance of the booster program. So as you know, all vaccines which are used in the UK have to meet strict safety standards, quality standards and effectiveness standards, and these are set out by the MHRA. And we're really pleased that over the past year, we've seen the MHRA working with the Department of Health and the NHS and the JCVI in developing policies for vaccination and providing guidance on how those vaccines need to be used and delivered. Over the course of the year, we've understood more about the side effects of the vaccine. As we know, vaccines can cause side effects. Thankfully, now that millions of people have received them and received them safely, we now have a better understanding of these. So most of the side effects are mild and short-term, and not everybody gets them. And the common side effects are usually the same across gender, across race, by age, and usually only last a day or two. So some of the common side effects are on this slide, which are the pain and tenderness in the site that you have the injection. Some people have felt a little bit tired. You can get headaches, aches and chills, but those generally go after the first 24 hours and can be easily managed by taking over-the-counter pain medications, paracetamol, etc. So the side effects generally have been mild and the vaccine has been well tolerated. Now, over the course of the year, we've learned about more serious side effects. So, for example, rare cases of inflammation of the heart, which is called a myocarditis or pericarditis, have been reported after Pfizer and Moderna. And you'll recall earlier in the year with the AstraZeneca vaccine, there were some concerns about cardiovascular disease, blood clotting conditions which were caused by the vaccines. Now, the good thing is, because of the work of the MHRA, the NHS and the JCVI and the Department of Health, when we have signals of serious side effects, we're able to modify the delivery of the vaccination program and take steps to reduce those side effects. And so we've changed the way, for example, the AstraZeneca vaccine is delivered and who gets the AstraZeneca vaccine. And we've also used our learning to ensure that we really integrate these messages in counselling to people who are getting the vaccines. Over the last year, we have clear evidence that there is absolutely no evidence for the vaccines having any impact at all on the fertility of men or women. I know that there have been a number of studies which have been exploring the impact of the vaccines on women's menstrual cycles, and this is an area that continues to be investigated. But as far as fertility is concerned, there's no evidence to suggest that the vaccine has a negative impact. So that's a vaccine, and we've been really working on the first 2 doses of the vaccine over the past year. And now as we are entering the winter period, we now have a better sense that actually to complete the vaccination course and to have maximum immunological power to deal with the virus, we need to have at least 3 doses of the vaccine. And so the booster program is going to be an essential part of building community resilience against the coronavirus as we enter the Christmas period. So we know that so far the booster program is rolling out well. Millions of people have already had their booster jab. And as of this week, we know that there's now a new national push to extend the booster program to all adults over 18 years and over. And the program will be rolled out over the next 2 months. So by the end of January, everyone who's eligible for a booster dose will receive that booster dose. Now, this means that the NHS is going to be expanding its activities significantly in the weeks and months ahead to ensure that everybody gets access to their vaccines. Now, why are the booster doses important? Well, they're important for 3 key reasons. 1, to ensure that you have the highest protection against the virus and against variants of the virus. Second, because the booster doses increases your immune resilience, it means that it reduces your risk of becoming infected, but more importantly, ensuring that we're protecting those around you as well. And third, it really helps because it is going to be a key part of building our resilience to new variants of concern. So while we are still investigating Omicron and the impact of Omicron on vaccines, what we want to do is to ensure everyone has the vaccine protection that they need going into the winter. So important to reduce rates of infection, and as we see evidence of waning immunological resilience from the second dose, it's a way of ensuring that you increase your resilience as you enter the winter period. I'm going to end now by just reflecting on the other infectious diseases which we're really concerned about during the winter period, and that's flu. The good news is that although we are dealing with the coronavirus pandemic, many of the steps that we're taking to reduce coronavirus transmission also work in reducing flu transmission as well. Nevertheless, we want to ensure that everybody gets their flu vaccine at this time, because we now know that co-infection with flu and COVID can lead to worse outcomes. And we know that many of us have experience of getting our flu vaccines every year as part of our health and well-being. And we want to ensure we have high uptake of the flu vaccine as well as the coronavirus vaccine as well. So really important that we don't just focus on the COVID vaccine, but we use the opportunity to get the flu vaccine as well. So in summary, colleagues, I wanted to spend my time just to highlight where we are with the pandemic and why, as we move into this new phase with increasing rates as well as the new variant Omicron, we all need to protect ourselves as best as we can. I spoke a little bit about the vaccine program. We had a video of how the vaccines work. I hope that was helpful in terms of reassuring you about the molecular process behind how vaccines work. But also we discussed the side effects as well. And with millions and billions of people around the world having received the vaccine, we understand the safety profile, we understand the effectiveness, we know it doesn't affect fertility, and we know it does protect you against severe disease and death. It is the most powerful tool we have in helping to protect ourselves as we enter the winter period. And then finally, I spoke about the booster program for flu as well as for COVID, and why getting the booster is so important at this time, both to ensure that you are well protected for the winter, that you maximize your resilience, your immunity and your resilience, and you help to reduce the risk of transmission of infection by virtue of having a more resilient immune system. So with that, colleagues, thank you so much, and I look forward to your questions today as well.
Hi, so we've had very kindly people have been submitting their questions early in advance of this meeting. So I've sort of sorted them all out, and I'm going to start with the questions which I think we would like to direct to Professor Fenton, as I'm aware that he's not able to stay with us for the whole session. So without further ado, the first question I have for you is quite a simple one, I think. Will the vaccinations be made mandatory for healthcare staff, and when might that happen?
Okay, so the government has